Okay, good afternoon, everyone. Thank you for joining us today for our Seniors Blue Book University. My name is April Garrett. I am the publisher of the Seniors Blue Book of Greater Pittsburgh, which is a free semi-annual resource available for seniors and caregivers. I'm excited to announce that we just finished our 6th edition of the book yesterday, and it's off to the printer, so it will be available in hard copy form within the next few weeks. At that time, it will be available at your local Walgreens, but you can also reach out to us at seniorsbluebook.com or at 412-551-5951 to request a copy to be mailed to you. We at Seniors Blue Book decided to start SBB University probably about 4 months ago. So right now we have just an ongoing monthly educational series every third Thursday of the month. Eventually, as the vaccine goes out and things start to open up, we will plan to transition these to live events, but for right now, this is what we're doing. Today, we have an exciting topic of alternative therapy for aging well. It's going to be presented by Bobbi Kolonay, who is the president of Holistic Aging Options in Elder Care. Her practice is based out of Pittsburgh, and she's traveled the world, and she's going to share with us traditional medical practices that she has learned over the years that she has been able to offer to clients in her practice. Just a quick couple housekeeping items. We are recording this event. We are going to ensure that only the presenters show up on video. If you need to step away from your laptop and you miss a piece of the recording, we are going to, like I said, record this, and we're going to blast it out to the attendees afterwards through email. So if you miss any of it, no big deal. But that being said, I'll turn it over to you, Bobbi, if you want to start the presentation.
Okay, great. And thanks everyone for attending. This is such a fun topic for me to talk about. It is probably the root of who I am as a human being, and probably have been since I was a young child gardening in my backyard. So it's very, it's different than my practice. So I'll describe myself to you a little bit first. I have a aging life care management practice in Pittsburgh. What that is what families hire us. We are private paid to manage the life of their aging parent. Most of our clients are 85 to 95. I've been in business 18 years. I have registered nurses and a speech pathologist that are life care managers that work for me. So I've always had a passion for plants and herbs and just communicating with nature. But when I started, and I'm a nurse and specialize in geriatric, I have a master's degree. And I was certified as a care manager and as a holistic nurse. So when I started this practice, my main focus was clinical care and only doing what was proven by research, and kind of followed the regular modern medical model of care. But as I progressed as a person, what I realized, and as a professional, was that this Eastern medical model of care really does not work well with people that are aging. The less tests you do, the less medication you're on, the less invasive procedures, and the longer you can live in your home, people age the best. And so I searched out alternative ways of helping my clients. And I guess I'd preface this with saying that not all people view this as something that they want in their care. So, we offer this to our clients, but some of them really don't acknowledge that this is the way they want to be treated. So we never force this. And I would recommend, if you're real into this, that you don't force this on people too, because for some people, it's just not they don't conceptualize medicine that way. So the regular medical model of care, which is what we practice in the United States, our Eastern medical model of care, we approach from a point of disease and illness. Physicians traditionally, they're seen as the expert. You go to see your doctor Things are changing, but typically they're telling you what to do, and you're complying with their advice. The doctor I go to has given me referrals and understands where I come from, but I use turmeric as an anti-inflammatory rather than non-steroid anti-inflammatories like Advil or anyone like that. And I told him that, and he's like, "Oh, that's great. I agree with that. I think, I agree with that." And I'm thinking in the back of my mind, I don't care if you agree with it. It's what I'm doing. But it's the way physicians were educated. It's the way medicine works in the United States. And things are changing. Patients are coming in now. Clients are coming in now as more educated consumers, and they are looking to their physician to have some knowledge of alternative methods of care. So in the Eastern model of medical of care, you treat disease and injury. That's why you leave a doctor's office, you have a script for a medication or a test or something to be done to your body it's in a state of disease. So you're treating underlying pathology in an attempt to correct the abnormality or care. What's frequently left out of it is the social, psychological, and other external factors that may influence care. And there are, it's a shame because everything about your whole person will affect your physical health. And, as care managers working with the aging population, or really anyone, things show up in your physical body that are things that could be related to something psychological or any external factors. And that's kind of been denied in medicine in the United States. So medicine is both an art and a science, and I combine them both. I totally agree with science and research, but there's also an art to it. And today we're going to talk more about the art. So the question that you always want to ask is, rather than, what disease do you have? Let's figure out why you have this problem in the first place and what we can do to restore function. So I have traveled the world. I'm just touching on a few places that I found the most intriguing, and I thought you'd find the most interesting. I'm leaving out a lot of other places that I'd be glad to share personally. I've been to probably 40 countries in COVID. I usually try to travel somewhere internationally twice a year, once for education, once for fun. And COVID has stopped that. So I went to study traditional Chinese medicine in China. That was probably close to 10 years ago. And the Chinese system of care, we initially started in the larger city areas, such as Beijing and Xi'an, and we toured hospitals there. When someone in a hospital in China gets admitted for, say, a stroke, a CVA, and we'll just use clinical, like they have left-sided weakness, they're going to be treated like they would be in the United States with blood thinners and physical therapy, occupational therapy, and speech therapy. But also at that exact time of admission, when they're hanging the blood thinner, they are going to be doing acupuncture. They have very little problems with recovering of weakness, paralysis on one side of your body. I know there are some medical people on this and some aren't. I'm going to gear it towards more the non-medical people and try to not use that medical terminology. So I think that shows you, and what acupuncture does is, and I'll talk about a little bit further, is it's stimulating it's called qi, the energy in your body to heal itself. So I found that pretty fascinating. So we toured. Now this is a communist country. The care there is not comparable to our care here, but their approach is because they have such less money and such a large number of population to treat, they need to keep people healthy, and that's the approach they use. So after we toured all the cities in the first week and a half or so, we went to a southern area. It's called the Yunnan province, and actually, if I go back to here, so this woman is 98 years old. This is her grandchild, and he was pretty big, on her back. And these, you can't see it real well, but over here to the left are this area, that Yunnan province. It's in the southern area of China, and it's where they grow tea. Like one of their biggest exports is a tea called pure tea. So the family, he's a third generation, her great grandchild, and everyone else is working in the fields here. Our bus went by, we were in this little mini bus kind of thing. It went by this area and we stopped to talk to them. And it was an amazing, cool 45 minutes of experience when they're speaking Chinese, Mandarin, and they're speaking a different type of Mandarin because it's different. What's spoken in the South is different than in the North. So our interpreter couldn't even interpret what they were saying. They do live in generations, and they are, amazingly very healthy. And I'll tell you more about that. I wanted to go back to that so you understood. So we are in the southern Yunnan area of China, and we were learning from village doctors. They're called Barefoot Doctors. So their education they could be a regular MD that goes through their med school, or if it's a very remote area, what they just do is they train people right out of high school for a 2-year period to be like a doctor for remote villages. And the interesting thing so this is the Barefoot Doctor. This is a dirt floor. And, it's very antiquated in there. We help them out seeing patients for a few days. And this is who he's training. She's a younger woman. No toilet. In the back here is a hole in the ground that you squat and go to the bathroom in. So very different, but you totally have to appreciate the way that they practice medicine here. So it's a communist country. These physicians, they are paid by the country, by the communist country, and they're paid to keep people well. So if and their village is 4,000 people. They don't make appointments. They kind of just show up here like he's waiting at the door. And they wait in line kind of here at the front door. If one of their villagers gets sick and end up hospitalized, their salary is reduced. So they are incentivized, the way we see it, I mean, it's the norm to them, they're incentivized to keep people healthy. And they focus on prevention rather than cures. So they will resort to Western medicine when their traditional medicine is not effective. And one of their main focuses is to decrease infectious disease in their village. This is their CDC board right here. So this lists all the possible infections that are occurring in their village and the treatment for it. And this is right outside. This is posted right outside their office here. And so that's the way, let me just see what my next slide is here. Okay, so I'll just give an example. So when you go to a Barefoot Doctor, you're a villager in China, and this is the doctor you go to for treatment, and you have what's an upper respiratory infection or possible pneumonia. They don't know at first. You're going when you're first having symptoms. What they're going to do initially is use food as medicine. So there's lots of foods that have decongestant properties to them. And you can almost, by the smell of them and the texture, you would probably even know that yourself. Like in the United States, rosemary, the herb rosemary is a decongestant. You can kind of tell by, if you smell that, you feel like it's cleaning your sinuses out. So a lot of families in China already have this as part of how they grew up. It's part of their culture. They know what food is medicine. Every home that we visited in China had one of these decoctions. And what they are is there's alcoholic content, small alcoholic content to it. I think these are goji berries. And then they make up mixtures for what they feel their family needs. And they drink this throughout the day. And they do it specific to, if it's a damp, rainy season and they're feeling congested, they'll make it up according to that. So that's what the doctor will initially do. He's going to prescribe food for medicine, types of foods that'll help with decongestant, bringing down fevers. Another option that they use, it's called sound healing therapy. There are different intonations in your speech, that can create vibrations in certain areas of your body. And I'll just give you an example because that may be hard to understand. So he may say, I want you to do the sound of C. The C sound vibrates your kidney areas. So it's something like C. And there are different sounds that vibrate different areas that is bringing energy to that. When we were in China, it's such a huge times difference. Even though we were there for a long period of time, we tend to wake up at like 4 a.m. So they have parks everywhere with water. So we would always, me and other medical people, we would go to the parks in the morning to walk around. And you would see people doing this on their own by the water. They're doing this sound therapy healing, and then they're also doing tapping on their parts of their body, which is just like a self type of acupuncture. But this is, they're in their suits and ties and their dresses and their high heels, and they're on their way to work, but this is what they're doing first thing in the morning. Very different than how we exercise. We're running or we're sweating or we're moving really fast. They don't perform exercise that way. The other thing is he may recommend Qigong or Tai Chi. Now, you probably have heard about Tai Chi. It's you do slow movements. It's great for balance. It also is moving energy throughout your body. And that came from Qigong was suppressed with one of their rulers. So Tai Chi came out as a result of the practice of Qigong, which came, out of their samurai warriors is really what Qigong came out of. So they're going to recommend certain movements to do that's going to bring energy to those areas of your body that you need for your lungs to heal. And then maybe they'll do that for a day or two. And if they're not feeling as well, feel like they still are congested, they're going to come back, and then they're going to prescribe, they prescribe herbs, varying different types of herbs. These are drawers of herbs. When you go to the pharmacy areas in the hospital, there'll be, 100,000 of these in their pharmacy. And each one of these drawers has a certain type of herb or bug. They use scorpions a lot, or and those. This picture right here is an example of a prescription for someone. So this is, here's some modern medicine stuff that looks like that's some kind of pills of some type. And then these are all herbs. They're put in a plastic bag. They're all different. He's probably prescribing whatever. It looks like there's 6 different types of herbs that have healing properties. And we'll just use the example, they would have lung healing properties. And again, herbs, it's nature. Herbs have they're usually multifaceted. An herb can be a decongestant and have antibacterial, antiviral properties in them. And it's, you know, coming from, you know, the earth. So they also may consider acupuncture or cupping. I know that one swimmer, whatever his name was, Phelps, there was a swimmer in the Olympics anyhow that made cupping popular. So cupping is used, it's usually to bring congestion. I myself had pneumonia. I was diagnosed with pneumonia probably about 4 years ago. And I was like, well, I'm gonna try just using some, you know, using these methods and see if I heal. And, you know, they will do the cupping right on. So I had gotten a chest x-ray and I had actually gotten a script for, I'm allergic to penicillin, so whatever the other one was. And I didn't want to take it. I wanted to try this. And by using herbs, I was in acupuncture and cupping and some qigong and sound therapy and food, I was able to cure my pneumonia. So this is, and if you've ever had cupping in the United States, they may do it a little differently. They tend to use glass jars and they burn moxibustion in that. Most of the acupuncturists that I know don't do that now. They're afraid they're going to burn someone, and moxibustion has a funny odor to it, they say, and so that's why they don't like to use it. But the moxibustion itself helps bring out, they call it disharmony in your body. And then acupuncture is tiny little needles. If anyone has never had it, it doesn't hurt at all. You can't even really feel the needles going in. And what it does is it's helping, the concept behind acupuncture is you have, your body has energy that flows through it. And these needles are releasing the congestion or the blockage that's occurring in your body. And really fascinating, I mean, I could talk about this forever, is they have found mummies, you know, 5,000-year-old mummies with acupuncture points in the same areas that we use now. I think acupuncture is just much more acceptable. Even since I came back from China in the past 10 years, we have a whole lot of new acupuncturists in the Pittsburgh area. And, you know, if none of this works, then they'll resort to an antibiotic. But, you know, putting something into your body that is chemically made is their last choice. But it is a choice. And, you know, some people may need it, but maybe, you know, arbitrarily, so maybe 75% of the people don't. So I had an acupuncturist that worked at my office for a while. Her name was Mara. For about a couple years. This was one of our clients. His name was Jim. Jim's story is he was, and that's not his real name, but he was in Florida. They lived half the time in Pittsburgh, half the time in Florida. And Jim Jim was playing golf. His golf cart ran away from him. Jim ran after the golf cart, jumped on it, and got thrown off into a car, suffered a pretty traumatic brain injury that ended up causing a lot of upper cerebral spinal paralysis. So his upper part of his body wasn't working, arms, he couldn't lift anything. And even the lower part, his legs, he wasn't able to ambulate. And he was totally independent prior to that. So he came on as a client to our practice. And he was not interested in any of our non-traditional methods. So we had him in rehab, you know, we had him in getting PT, OT, speech therapy, until we maximized all that out. Even he was private paying, you know, for some. And we finally got him to agree to come see Mara, our acupuncturist. At the time, Jim wasn't able to lift his arms. He could shrug his shoulders, but he couldn't lift his arms, and he really wanted to get back to driving. After about 6 months of treatment with Mara, he could hold a cup in his hands. And we had him, you know, tested through a rehab center to return to driving. And he passed that and was able to return to driving. He became her best advocate for the service. And you can see he even has, this is an acupuncture needle. he has an acupuncture shirt on now. So it was pretty cool just seeing what just acupuncture could do to just help his body's nerve endings heal. So that's it on China. A couple years before COVID, you know, life is based on before COVID or after COVID. So right before COVID, that probably September or October 2019, I believe, I went to Peru again, it was another medical adventure. It was to study, you know, Peruvian, their traditional medicine. And then I went to the Amazon rainforest. So, whoops, this is sensitive. And this was a wonderful experience. We really learned their traditional medicine. And what's really interesting about Peru is their religious culture accepts, it's mostly Catholicism, and but the Catholic Church accepts shamanism. So they will have spiritual practices of both within the church, which I found amazingly wonderful. So shamanism is the oldest spiritual practice known to humankind. And there's archaeological evidence that goes back over 70,000 years. This is a shaman that actually did a healing ceremony with our medical group. And this is his son, who is in practice to learn how to be a shaman. From what we understand, it's becoming, you know, a lost art. What shamans view, they view illness as disharmony in a person's life. It's on an energetic and spiritual level. And that can lead to mental, emotional, and physical illness if it's left unresolved. So what a shaman does is he addresses the energetic and spiritual aspect of an illness, and he takes you on a journey into the astral or spirit world. And they may use, oh, wait, I think I wrote somewhere how to pronounce this. Let me look at my paper. Yeah, it's ayahuasca. So they'll use ayahuasca, which is a combination of two sacred medical plants to assist them in this journey. It's not like getting high with pot. We did it. I think it just increases the level of your being able to think and travel in your head. So he did this wonderful ceremony. You can see here is where it was all laid out at. We eventually moved to these chairs here. This is him. They have cocoa leaves as part of their everyday life, which is great because you get, it's a very high altitude, you get altitude sickness, and cocoa leaves help with that. So this is him, the very end part of the ceremony, giving my cocoa leaves. None of us taped the ceremony because we were all on, you know, our healing spiritual journey. So that was just a wonderful experience. I hope all of you at some time would be able to participate in that. And they combine in Peru, they always combine, they have a regular medical school, and they're, just go back. So their physicians are educated with regular medicine and traditional medicine. Their first, so when they graduate from med school, the first year they have to serve in a village. And their first year after they do their residency, and they're serving as the village doctor, and the villages are teaching them their traditional beliefs and their traditional medicine, so that they've, you know, once they leave that area, it's good on all aspects, because you know that these remote villages don't have doctors, and then they have a local, very educated doctor. The doctor themselves is learning directly from the villagers what their cultural differences are. And there were, again, I could probably just talk about that for another hour. There's lots of different, every culture has a different beliefs in medicine. And sometimes it's hard for modern medicine to get past that. I think which is very clear now. I went to India too, like India with the treatment of polio was very difficult. So part of this trip, and this was my favorite part because I am I hike, you know, I love the woods and communicating with nature, was learning about the medicinal plants in the Amazon rainforest. And we had the greatest guide. We stayed in these adorable little huts, and it was as hot as heck with no air conditioning, but it was, I don't have a picture of them, but it was such a wonderful, life-altering experience to spend, you know, a week in the forest, and on all the waterways throughout that area. So, and our guide, which you'll see more about him later on in the presentation, grew up in a family where all they practiced was using the plants around them. They never really saw a doctor. So they used all the plants in their backyard, which his backyard was part of the, you know, butted up to the Amazon rainforest. And that's all he used his whole life. So we were so fortunate to have a guide like him. Oops. So oh my goodness. One of the plants that he talked about, it's called abutta. That's this right here. So it's commonly referred to as the midwife's herb throughout South America. What they do is they use the vine or the root of it when someone is having a threatened miscarriage. It stops uterine hemorrhage and menstrual cramps. It also is believed to help in poor digestion, drowsiness after meals, and constipation. So you'll see most plants have a variety of properties that can be used for treatment. It's not like a medication that's just for one thing. And a lot of plants that complement each other grow beside each other. And I'll talk about the ones in the United States a little bit later. So that's abutta. Dragon blood. So what it comes out of, it's this substance, and it comes out of a tree. It's a very sticky substance. So I will show you. Here's my dragon blood. And it really does look like blood. You can see that on my hand. And they use this, and it gets like a sticky. So when I did this presentation, I could pass it around and everyone could put it on a wound and let it heal. It's a sticky type substance. And it's primarily used as like a topical analgesic. So any insult that you have to your skin, cuts, bites, burns, stings, rashes, it can play, it has and I'll use it myself instead of like a antibiotic ointment, because again, I don't want the less antibiotics you put in your body, the better it is for long term. So here's what it ends up looking like. You can even, I've put it on my wrinkles because it does, you know, it does heal, has that property, and it's helped with, you know, wrinkles. Sometimes it's due to inflammation. I put it around my eyes also. So it helps protect the cells in the skin. It reduces redness and swelling. It also has a group of compounds that repair collagen and help maintain protein that makes our tissues stick together better, which as we age, we lose that property in our skin. And it heals tissue. And what's great, again, like I said, a lot of these natural components, they're antibacterial, antiviral, antifungal. That's why it's so widely used throughout all of Peru to treat any kind of skin infections. So that's what's there. And then termites is a big thing that they use for treatment. So they use the termite itself, which means here's all these little termites. They're, you know, eating a termite to treat asthma, bronchitis, influenza, whooping cough. If you rub your finger in through here, you'll see there's this sappy stuff that the termites make, and that's also used for the same thing. So if you don't want to eat the termite, you can just stick your finger in there and use that. And again, they're walking out into the backyard and they're doing this. And this is just this is the close-up of the termites. This is how termites are on, how they live on. It seems like the majority of their trees have termites in them. When we never went out, so where we stayed was right on the right in the rainforest. We never left the rainforest without our guide, because any step you took, anywhere you went, there could be some plant or some bug or some, you know, ant that could bite you, or I mean, there's tarantulas, there's everything. He knew how to recognize that. So honestly, we stayed in our little camp area unless we were with Paulo. So I'm going to let you hear, I videoed him. This was our guide for the whole week we were in the rainforest. I'm going to let you hear him about how this acetoacetic acid that he got from a tree saved his life.
This plant actually saved my life long time ago. When I went to work the Brazil nut extraction, I got sick. I didn't carry any medicine. The landowner didn't provide me anything. But my friend brought me this. Paolo, you should boil it. I believe him, because I wanted to try this medicine because I was really, really sick. He told me, okay, Paolo, take the skin off and you can chew it or you can boil it. Because as you can see in there, it's juice actually. You can chew it. The liquid of this plant contains in Spanish we call the ácido salicílico.
Oh, so like aspirin.
That's right.
That basically is aspirin.
This is aspirin.
Yeah.
I believe it.
Well, if it has pharmaceutical, it's aspirin.
Salicylic acid is aspirin.
Just think we could take that instead of the manufacturer.
I can tell you. I can tell you it works because.
How were you sick? What kind of sickness did you have?
You know, when we work the Brazil nut extraction, normally we carry 100 kilos on our back. 2 hours walking, we are sweating so much. After that, it gets cloudy, rain, and it's like you put, you know, fire and water, explodes, right? My body was really, really hot. When the rain falls, actually the reaction was like explosion, right? Yeah. When I went back to the camp, so I got headache, terrible headache, and fever. The following day, I was in bed all day, 3 days in bed. I was really, really weak, very sick. We call this sickness, for example, arrebato. Arrebato is the name of this sickness. When hot plus cold, explosion, and you get fever and headache. My friend brought me this. She told me, okay, so let's split it in several little things. If you boil it, at least 5
minutes
liters of water.
5 liters.
Then you have to take a bath and drink a little bit. After 3 hours, 4 hours, the plant made me sweat all the time. All the time, I changed my clothes. And the following day, I was, I would say, 70 or 80% much better. That's why I believe.
I'll bet you could take that plant and make a decoction. So boil the plant,
yes,
and then boil it down to where it's not too much, and then take it and rub it. If you have soreness, you can rub it in because of the medicine.
Yeah, that is actually our local aspirin.
Right, that you rubbed it in directly? Right.
Yes. So many people in the Amazon normally treat for headache also.
Mm-hmm.
Could we have some?
What does it taste like?
I bet it tastes like aspirin.
Okay, so what he was saying.
This plant actually saved my life long time ago.
Let me just
when I went to work.
Stop him from talking here. So what he was saying was this plant, you know, and we figured out it was acetylsalicylic acid. He used a different Peruvian term for it. It sounded like he had something that you would, in the United States, we would call septicemia. When he's not working, he doesn't work in this position. They have a rainy season in the Amazon rainforest from like January until April. And during that time, he works, he labors carrying Brazilian nuts. So they have a campsite that they have set up. And then they go to the nut trees, and, you know, maybe the beginning, they're walking them out to the trees and picking all the nuts off. And maybe near the end, they're walking 5 or 6 miles, 7 miles, 8 miles. And, you know, he's carrying 200 pounds, and they get paid by the poundage of nuts that they bring back. So it's raining, it's damp this whole time, and he's carrying on his back, you know, 200 pounds worth of these Brazilian nuts. What happens is it breaks down all the skin on his back, and it gets infected with parasites. So what he is saying, you know, and to treat that, he almost died. It sounded like he was septic, blood poisoning, and this plant saved his life. So pretty fascinating. Now I'll let him tell you, because he can do it so much better than me, about, you know, during this rainy season, what his mother would, there's grubs that he'll tell you grows on the palm weevil in Peru. And they use that as a prevention during the rainy season for upper respiratory infections. Here's a close-up picture of that.
J.A. Chapaka from this palm tree.
Okay, so now there's a termite nest on the palm tree, right?
Right.
Termites go to any tree.
Now is the nest for some ants. Because
oh, that's ants.
It was termites already abandoned.
Ah.
So what happened? This palm tree actually, yesterday when we went to the Alexander Well, when you asked me about one big fruit hanging from the palm tree, it's the same species.
Okay.
And the fruits normally drop when they are ripe. So monkeys eat it, the flesh, and also they drop it. The fruit will be on the floor for 2 or 20 days. After 20 days, a beetle comes to make a hole to lay the eggs inside. The eggs hatch, and the larvae start to eat the nut, because in there is a nut. The larva will remain here inside eating the nut for 2 weeks Also, after 2 weeks, they make a bigger hole to the net. Come out.
So you have to catch them before they get out of there.
Exactly.
So if you find a net with a hole in it, you know the beetles are, I mean, the larva's already out.
Right.
Yeah.
For example, that means the larva already came out.
Okay.
As you can see.
Mm-hmm. Yeah. Yeah.
Now I will use my machete in order to find them. If we get enough lucky, we are gonna find 1 or 2 larvae. The larva here is considered to be one of the most important medicine for asthma. For cold, breathing problems.
Pneumonia?
For cough.
Upper respiratory infection.
Everything. I will use my machete and I will try to open it. Yeah, come on.
I'd offer to hold it there, but
Oh, yeah. Success.
oh,
For example, this larva, this is the nut. This one.
okay.
And this larva in here was eating the nut. I can see the white.
Yeah.
Mm-hmm.
Oh no. 1 minute rule.
As you can see, it's a small larva.
Mm-hmm.
My mother used to give me when I was a child every day this because during the rainy season we get sick, cold. But I don't like to eat the head because the head is crunchy and they can bite the tongue. Just I pull the head out and then I suck the oil.
You don't just eat the whole, just swallow the whole thing?
We chew it and we swallow it.
Can you just swallow it without chewing it?
You need to swallow, you need to chew it. That's the medicine. It's like coconut.
I'll try. All right, I'll try. There's only 2. Pull that head off. Well, we can share one. Made the mom some. Can you break it in 3?
Well, I can take another one.
Okay. All right, I'll take a video of you.
Just a moment.
So we did all try that. Just as if you would guess what it would feel like in your mouth, you're guessing right. But when in Rome. So I think what I found so fascinating is that somehow 1 million years ago or whatever, someone discovered that this slug or whatever he calls it could prevent upper respiratory infections. And how cool is that? So this is really about herbal medicine. And, you know, we touched upon just 2 countries. There's so many other countries that practice herbal medicine in varying ways. And I'll touch a little bit right near the end on how there's, you know, American herbal medicine too. So what herbal medicine is using plants to help treat you. So the majority of humankind possesses plant knowledge, or they have access to a person in their life that did. And, you know, 50 years ago, that made all the difference between life and death. The majority of the world still relies on traditional medicine. And even in a lot of the industrialized countries like Germany, I spent, you know, quite a long time there. People use folk remedies to treat illness every day. And I'm sure your grandmother or has passed down things to you, and maybe you didn't appreciate it as much, and you will after having attended this. They went to great lengths to retain this knowledge of, you know, the medicinal and edible plants that we used. I mean, people were burned at the stake and called witches in the Salem witch trial for having this knowledge, typically women. Due to Western science relying too heavily on written documentation, and I'm not saying there's anything wrong with Western science, but this is information that was passed down by many traditions, passed orally, not written down. So it tends to be minimized in the United States as not working, or that there is not enough data to prove it. But ingesting plants are so much less risky than taking concentrated manufactured supplements. As you know, there's so much more risk for contamination in the whole manufacturing process. So I hope you can appreciate herbal medicine. So I'm going to tell you, we don't have that much time. But some of the herbal medicine that I have used with my clients, and I even have some samples back here. So you can make tinctures. You heard one of the people mention him doing that with the salicylic acid. They were all the people that went on these medical conferences that I went to. They were all, most of them were nurse practitioners or physicians interested in this. So this is an elderberry tincture. What I have at the very bottom, I don't know if you could see it, is elderberry. And then this is some type of an alcohol. You have to use an alcohol that's 70% or higher. And I tincture, so what tincture means is you keep it in this type of setting with you use like a fourth of in this case, a fourth of the elderberry, 3/4 of alcohol. And for a good 2 months, if you keep it longer, it doesn't matter. And then what you do is as you can see from this picture here, I use one of these to strain it out, and then even a cheesecloth. I don't know if you could see it because the elderberry itself, it's quite small, the little berries. You can grow elderberry in your backyard. I have tried so many times to grow it in my back. So I order any of my herbal supplements that I'm using from Mountain Rose. You can find them online. They source their products just the way I like them. So in here, here's a tincture, and so elderberry. Whenever I travel, I always take an elderberry tincture and an echinacea tincture with me. I went to Japan with some great girlfriends, and I don't know why, the day I arrived, I was horribly sick. Like I thought this was going to ruin my trip. I was so sick I couldn't get out of bed. But I took both the elderberry and the echinacea every hour. I would take 4 or 5 drops for 6 hours, and I was like, amazingly, I was cured in less than 5 hours, which my roommate really appreciated. You think of elderberry as it's an antiviral, so any kind of viruses, you're actually improving your immunity to fight the virus. So, around COVID, I've been taking this all the time, and any of my friends, or we encourage our clients to. Again, some are interested, some aren't, and it's so simple to make it. And then here's echinacea. Let me just grab some from here. So here's my echinacea. So echinacea is cone flowers. You probably have them in your backyard if you're in the northern area in Pittsburgh. They're the purple cone flowers. It's been used for centuries to treat common colds, bronchitis, upper respiratory infections, and inflammatory conditions. So this is it being tinctured in here. And you use the echinacea plant has to be at least 3 years old. You're going to use the root of the plant. I mean, you have to clean them and disinfect them well. And then all the parts of the plant for the echinacea. Actually, you could put in your tincture because the different flowers or the root or the branches have different properties. If anyone lives near me, they're welcome to come. I have way too many echinacea plants in my yard, and I'd be glad to dig some up for you. So those are two of the most common ones that we will use with our clients throughout our practice. We also use valerian root, so you can grow that in your backyard. It's very, if you're, and I know the Pittsburgh area, it grows very easily here, and that's great for people that have anxiety. A lot of our clients with dementia or neurocognitive disorders, seems like anxiety is a natural part of that when they're declining. And that's one of the greatest, rather than giving them some kind of drug that can change has an effect on their cognition and their balance. We use valerian root for that. And again, I make it up the same way I make up the echinacea. And we also, we've used medical marijuana with our clients in Pennsylvania. Medical, as long as you meet, I mean, there's probably 25 different diagnoses now. You can get marijuana from you can get marijuana. And so we have our staff signed up to be caregivers that they could go and speak with the pharmacist. We've mostly used medical marijuana for for pain with our clients. Trying to think of, I think that's all that I can remember. And so when they're prescribing the medical marijuana, it's always good to talk to someone. A lot of these dispensaries just don't have pharmacists. They have employees that are educated on the use of marijuana. So we make sure we go to a specific dispensary where we can talk to the pharmacist directly about our client and give them information. They always start with the very lowest dose of THC that they could possibly use. And we've gotten 3 of our clients with pain off of opioids and using medical marijuana. Unfortunately, in our area, it can be very expensive. And then so these are common things. We have a lot of other ones that we use. So we use Demantos. This is an example of a company called Pure Cranberry Demantos. For any of our clients that have chronic urinary tract infections, as long as the bacteria causing it is E. coli, we have found this to be tremendously effective. What it does is it prevents the bacteria from adhering to the lining of your bladder. What's great is we even have had, we've talked to physicians when we go and talk to them about it. And this seems to be one they're pretty agreeable to. And now we see them prescribing it to their clients. So I love that when we're able to make just even a tiny influence like that in the life of our aging population. So what I really, my goal was really to just open everyone's eyes to the fact that there are so many traditional medicines that are out there that have been proven, handed down. through verbal, handed down, have been maybe not research proven, but anecdotally have been used for centuries. And that's enough for me. So, you know, we talked about traditional Chinese medicine and the Amazon rainforest, a little bit about American herbology. The common threads that I'd hope that you got out of it is that, you know, using herbs is less invasive than any kind of conventional medicine and has fewer side effects. Older adults are much more prone to any kind of problems from any kind of standard medical treatment. A lot of older adults are turning to and asking their practitioner's opinion on some of these supplements. And, you know, some practitioners are a little more educated. Some will tell them not to use them, which is harder because an individual really respects their doctor's opinion on things. So while traditional research doesn't provide answers, you know, my scientific mind really likes the research, but I've really come to accept this, you know, having been in direct contact with the people that this is their primary way of practicing and seeing how healthy they are. This anecdotal evidence is an experience evidence has been enough for me. And the fact that some of these approaches have been around for centuries just tells me that they're working. So what Albert Einstein said is look deep into nature and then you'll understand everything better. And this just gives you an idea of the things that I sought out to make myself a more educated and alternative therapy. And I'm also a beekeeper. So I'll gladly take any questions. April, do you have them raise their hand or they type it in or how do they?
There is a chat feature at the bottom. If you just click on chat, you can enter in. I did see that Darla had asked, I think it was a while back, if they were eating the termites, which I think you did say they do.
Yes. I know, there's a lot. But I've tried everything. In China, they use Scorpios. I forget what they use them to treat, but I ate a whole scorpion. It's like a bugle. I don't know. I know you're younger, April. People my age group grew up with bugles. I was like, it tastes like a bugle.
What was that website you mentioned? Mountain Rose? Is that what it was?
Yeah, so Mountain Rose, they, anything you buy from them is, you know, they don't use any pesticides. They really source their products. So Mountain Rose, I think it's out of Oregon. It's near Portland, Oregon. That's where I get all, if I try to grow them in my backyard because there's a thing about, you know, growing in your soil, it being as close to you as possible that it will be designed more for your body. But, you know, a Mountain Rose, they'll carry any kind, I should have brought up a bag. They carry almost any kind of herb. So if you don't want to grow your own, I just want to make a tincture, you can get almost anything. If you want to use essential oils in your daily life, they sell essential oils there also. If you're interested in American herbology, I studied it with Juliet Blackenspore, who is out of Asheville, North Carolina, and her school is called the Chestnut School of Herbology. She doesn't do it. I went to her last in-person class. I slept in a yurt for 2 weeks. I will never do that again. It was freezing. I was the oldest person there. It was quite the experience, you know, but I was freezing. I was like, oh, just give me a hotel. But it was a great learning experience, and we really learned a whole lot. And she has great online learning, even some free stuff. I think you may find there might be free ones on how to do decoctions. So she's great. And then a Rosemary Gladstar is another person that has been practicing herbology for years. People, I've been to, they have conferences. They have a National Society of Herbology. So it's a master's degree. People, you know, that do this and they'll treat patients with it. They have a master's usually in herbology. So I went to their national conference was at Seven Springs, maybe 2 years ago. So I got to go to that. That's cool. That's where I learned some honey stuff too. Like I tried to make medicinal properties in my honey.
Does anybody else have any other questions? Or if you want to unmute yourself, feel free to unmute yourself.
If you see that little mute button, you can like unmute it. Physically ask a question. I
don't see any other questions, so. Well, thank you so much for your time today, everybody. Thank you, Bobbi. That was very interesting.
I know.
Well, anything to keep off of, like I'm a firm believer of trying to not be on opioids and drugs and putting chemicals in your body. So that's why I was really interested in this presentation myself, just because I find it really fascinating.
Yeah, and we're just barely touching the surface. I mean, even doing something on just American herbology, but you really have to understand. I like understanding the history of where all this came from, and I think that makes you appreciate it more. So.
Interesting. All right. Well, thank you so much. Thank you for attending today. Hopefully we see everybody next month for our next Seniors Blue Book University, usually every third Thursday of the month. So I'll keep everybody updated with the next topic.
And this is available online on your web. A lot of people are asking me on your website will the people that attended this get a link to that also?
Yes, we'll send out a link of the recording of the video, and I'll include your contact information, your website information. So if they have any questions, they can reach out to you directly, and then we will blast it out on social media too. So it'll be available on there.
Okay, thank you.
Sure. Well, thank you so much, everybody. Keep warm and take care.
Take care.